Initiating peripheral intravenous therapy. Venipuncture is a technique utilized to initiate peripheral intravenous therapy. Venipuncture itself is the process of accessing a vein by puncturing through the skin with a sharp, rigid stylet, butterfly needle, a partially covered plastic catheter, over the needle catheter, or a needle attached to a syringe. To initiate intravenous therapy, which is to provide medication and/or infusions into the venous system, the butterfly needle or the over-the-needle catheter are utilized. Gloves. Gloves are an OSHA requirement. A new pair of gloves must be used for each patient and removed when the procedure is completed. Non-sterile gloves are used. Antiseptics. These are solutions that prevent or inhibit growth of bacteria and are used to cleanse the skin prior to venipuncture. Chlorhexidine gluconate is the antiseptic cleansing agent of choice. 70% isopropyl alcohol is another agent which comes in individually wrapped prep pads. Alcohol povidone iodine. In combination, the alcohol is used first as a defatting agent, and then the povidone iodine is a topical anti-infective that reduces skin surface bacteria. It must dry to be effective. Sharp containers. These are special, puncture-resistant, disposable containers used for safe disposal of needles, lancets, and other sharp objects. Tourniquet. A tourniquet usually is a flat strip of flexible latex or non-latex tubing applied to the arm to cause veins to enlarge. It should be tight enough to reduce the speed of venous blood flow, but have no effect on the arterial blood flow. You should be able to palpate a radial pulse. Needles. There are different types of needles, but all are disposable and single-use only. They have a safety device designed to reduce the risk of accidental needle sticks. The wing-tipped or butterfly needles have a stainless steel shaft with rubber or plastic wings attached to it. The advantages of this catheter are, number one, it's excellent for one-time IV meds. Number two, the wings allow ease of insertion and secure taping. Number three, it's useful for infants, children, elderly, and other adults with small veins. The disadvantage of this catheter, however, is that the needle is not flexible, and it also increases the risk of infiltration because the steel tip can easily puncture the vasculature after placement. An over-the-needle catheter is a needle or stylet inside a plastic or Teflon sheath. The point of the needle extends beyond the tip of the catheter. Once the vein is accessed, the stylet is removed, leaving the flexible catheter in the vein. The advantages of this catheter are stability, allowing for greater patient mobility, and the catheter can stay in the patient longer and is used for long-term therapy. And also viscous liquids can be delivered through these catheters. The disadvantages, however, is the increased risk of phlebitis. It is also more difficult to secure compared to the wing devices. Needle cannula selection. Select an appropriate size for the purpose of the infusion. Use a 20 to 18 gauge needle for blood administration, a 20 to 22 gauge for continuous or intermittent infusions, and 22 to 24 gauge for fragile veins, pediatric and elderly patients. Tape. Tape is used to secure the catheter and prevent movement of the cannula. Sterile dressing. A sterile dressing could be a transparent dressing, which is occlusive to moisture and microorganisms, but allows continuous observation of the IV site, or it could be a gauze dressing. The gauze dressing must have all surfaces and edges secured with tape to ensure the dressing is closed and intact. Towel or pad. A towel or pad needs to be placed underneath the patient's extremity to protect the bedding. Infusion set or saline lock. Another name for saline lock is a male adapter. These are primed prior to venipuncture to provide attachment to the inserted catheter. IV selection. The metacarpal, cephalic, basilic, and median veins are the veins of choice for venipuncture due to their size and location. The use of the foot and the scalp as an IV site are common with children. When choosing a site, Start at the best, lowest vein. Choose a vein that is large enough for catheter placement, but will not interfere with the patient's activities. A soft, straight vein is preferable. Try to avoid areas of inflection, like the antecubital and wrist areas, bruised or swollen veins, painful areas. Avoid vessels in extremities with compromised circulation, for example, dialysis grafts, mastectomy, or paralysis. Also avoid edematous, infiltrated, or phlebitic areas, sites distal to previous venipuncture sites, sclerotic or cord-like veins, areas of venous valves or bifurcations, and also avoid burned, scarred, or tattooed areas. Step-by-step procedure. Initially, the nurse checks the physician's orders. The nurse will enter the patient's room, identify and greet the correct patient. Assist the patient to a comfortable sitting and supine position. The nurse then explains the procedure to the patient. This decreases anxiety and promotes cooperation. She will need clean gloves, a tourniquet, skin prep per the institution's policy. That could be alcohol, chloroprep, or an alcohol-betadine combination. The nurse will need an intravenous catheter, a towel or pad to put under the extremity, tape. If an IV is ordered, she'll need an infusion set, or a saline lock if that is ordered. To prime a saline lock, inspect the sodium chloride vial for clarity and the expiration date. If it is a newly opened vial, mark the vial with the date and time it was opened and your initials. Remove the cap from the top of the vial. Cleanse the top of the vial with an alcohol swab and allow it to dry. Open a sterile vial access device and insert it into the top of the vial. Cleanse the top of the vial access device. Open a 3 cc syringe. Draw up the amount of air equal to the volume of sodium chloride to be withdrawn. Usually it's about 2 cc's. Connect the syringe to the vial access device. Inject the air into the vial. Invert the vial with your non-dominant hand and withdraw the 2 cc's of sodium chloride, holding it at eye level to determine the correct dosage. Examine the syringe for air bubbles and expel them back into the vial. Recheck the volume of sodium chloride for accuracy. Remove the syringe from the vial access device at this time. Open the saline lock package and connect the prepared syringe to the saline lock. Remove the protective cap at the end of the saline lock. Inject the sodium chloride until you have a drop to the top. Place the saline lock with the syringe still attached into the package to maintain sterility. The nurse prepares the IV solution and tubing, or if a saline lock is ordered, the nurse will prime with 2 milliliters of saline or heparinized saline according to the institution's policy. Next, the nurse will select the site. To do this, the nurse applies a tourniquet to the extremity approximately 6 to 8 inches above the venipuncture site. If the veins are not readily prominent, the nurse may ask the patient to open and close his fist several times, or we may tap the vein lightly, or the nurse may stroke the vein distal to the site in the direction of the venous flow toward the heart, or you may allow the arm to hang over the side of the bed, or you can even apply warm soaks to the area for 10 to 20 minutes without the tourniquet. Applying the tourniquet for no more than 1 minute to minimize effects of stasis and hemoconcentration. At this time, the site may be marked. To do this, use a straw to make an indentation in the skin. After it is marked, release the tourniquet and cleanse the site according to the institution protocol. Place the towel or pad underneath the extremity being used, positioning the patient properly. If using alcohol, swab in a circular motion from the site outward. If using ChloraPrep, use a repeated back and forth stroke of the sponge for approximately 30 seconds. Allow the area to dry naturally. If using a shielded IV catheter, remove the needle cover and rotate the catheter hub 360 degrees. Carefully replace the needle cover as not to activate the protective needle device. While the site is air drying, set up the supplies, cutting the tape, etc. Don clean gloves and reapply the tourniquet. With the free thumb, stabilizes and anchor the vein distal to the insertion site by pulling taut below the entry site. Holding the flash chamber of the catheter, use a direct or indirect method of insertion with the bevel up, entering the skin at a 10 to 30 degree angle, depending on the depth of the vein, and insert the catheter through the skin and into the vein in one thrust. Observe for flashback of the blood in the flash chamber. Then lower the needle until almost flush with the skin to avoid puncturing the wall of the vein. Stabilize the flash chamber and gradually advance the catheter off the needle until it has entered the vein to the hub. Finally, release the tourniquet. Hold the hub securely while applying digital pressure to the vessel just above the catheter. Press the button that retracts the stylet automatically. Attach the primed IV tubing or saline lock and secure with tape. Aspirate for blood return and flush for patency. Remove the syringe from the saline lock and apply the dressing. The dressing should cover only the insertion site and the catheter hub, leaving the hub end clear to facilitate line connection. On a piece of tape or provided label, write the catheter gauge, date, and time of insertion, and the initials of the person performing the venipuncture. Apply the label to the dressing. The label should not obstruct visualization of entry site. Reposition the patient and clean the area.